Faced with new tasks and in new situation. Today, the General Office of the State Council Interagency Task Force has adopted new measures to further optimize our prevention control. And there are new provisions on NAT testing, the way of quarantine, medicine needs of the general public, the people at risk management, normal social running, anti-pandemic related supply guarantee. Further optimization measures have been adopted as new 10 points with a view to be more scientific and targeted in our prevention control. We say no to oversimplification or arbitrary imposition of restrictions. Apart from nursing homes, health institutions, kindergartens, primary and secondary schools, NAT testing result is not the requirement for entry. Health barcode and mobility barcode will not be checked. We will also cancel arrival test. Localities are required to be robust in implementation of the new 10 points. Today, we will focus on further optimization of prevention control efforts. We have with us Deputy Director General of National Health Commission, Head of National Administration of Disease Control, Mr. Wang Hesheng, Deputy Minister of National Health Commission, Mr. Li Bing, Madam Guo Yanhong, DDG of the Emergency Response Department of National Health Commission, and Head of the Pandemic Response Leaders Experts Panel, Mr. Liang Wannian, Director of Science and Technology Development Center of National Health Commission, Mr. Zheng Zhongwei, also Head of the Vaccine Development Ad Hoc Working Group, to jointly take your questions. Now the floor is open for questions. Please identify yourself before you ask questions. Thank you. With the people stating, in the past 3 years, China has done a lot of work in pandemic prevention control. The virus keeps evolving. We see multiple outbreaks in different localities, and some regions see the flaring up of cases. Are our experiences outdated? Are they still valuable for the current prevention control efforts? I'd like to invite Mr. Wang Hesheng to take the question. Thank you for your question. Since the outbreak of the pandemic, under the strong leadership of the Party Central Committee with Comrade Xi Jinping at its core, with the joint efforts of the entire society, in particular with the understanding, support, and involvement of the general public, in face of the unknown emerging infectious disease of the COVID-19 pandemic, we keep accumulating experiences. In the past 3 years, we have been prioritizing people and their lives. We've effectively dealt with over hundreds of cluster outbreaks and effectively responded to 5 global waves of surges. Infection rate and fatality in China have been kept the lowest across the world, and we have fostered a great anti-pandemic ethos. In the past 3 years, we've issued 9 versions of prevention control protocol and diagnostic and treatment protocols. We've adopted the 20 optimization measures and further optimization points. The stability of our strategy, the consistency and flexibility of our measures have been the effective answer to the uncertainties posed by the pandemic. In the past 3 years, we have developed effective diagnosis and treatment technologies and medicines. In medical treatment, pathogen testing, epidemiological survey, our capacity keeps improving. Research, development of vaccines and vaccination have made phenomenal progress. The 3-dose vaccination across the entire population has exceeded 90%. The health awareness and health literacy of the general public have seen substantial improvement. The practices in the past 3 years in fighting the pandemic have been effective in safeguarding people's life, health, and safety, created environment for the production, people's livelihood, and the favorable investment, development, and business environment as a testimony of the superiority of socialism with Chinese characteristics, and these serve as the cornerstones of today's prevention control efforts and created favorable conditions of our further optimization of prevention control measures in the past 3 years. We constantly adjust our prevention control measures, with each round of optimization being prudently built on previous practices. We've been looking into problems, carried out in-depth studies and validation. Each round of optimization of our measures have become more scientific and targeted, with a focus on the features of the virus, domestic and international pandemic situation, domestic and international prevention control strategic changes. We have been contextualized our prevention control measures in accordance with the changes. Each round of the optimization has been people-centered, with a view to safeguarding the normal life and production order of the society, with a particular focus on the protection of the elderly, infant, and young children. Thank you. Next question, please. With CCTV, what is the context of adopting this further optimization measures? Since we adopted 20 optimization measures shortly before, why are we having the new points? Compared with the 20 optimization measures, what are the major changes in the 10 new points? I'd like to invite Minister Li Bin to take the question. Thank you for your question. In the past 3 years of the pandemic prevention control, the Party Central Committee and the State Council have been prioritizing people's life, safety, and health. We've been contextualizing and optimizing prevention control measures in accordance with the changes. We've adopted 9 versions of prevention control protocols and diagnosis and treatment protocols. We've adopted the 20 optimization measures. The consistency of our strategy, the flexibility of our measures have been the effective answers to the uncertainties of the pandemic evolution. With large-scale vaccination, the mutation and evolution of the virus, we see stronger transmissibility but attenuated pathogenicity. The overall health risk for the entire generation is becoming mild. We are faced with new situation and new tasks in our prevention control efforts. Shortly before, we adopted 20 optimization measures, which are based on scientific evaluation of the 9th version of prevention control protocol and the National Vacation Protocol. With the adoption of the 20 optimization measures, we've been following closely the implementation effects in different localities in light of the effective experiences, and most pronounced problems occurred. We further put forward new 10 points. For these new 10 points on NAT testing, management of the infections, management of close contacts, the zoning of high-risk regions, vaccination of the senior, and medical needs and medicine needs of the general public, tempers pandemic prevention control, pandemic-related guarantee, further optimization measures have been adopted. In general, the 10 points can fall into 2 major categories. The first category of the measures is for further optimization in light of the features of the virus, the evolution of the pandemic, and this has been based on the practices of local responses. We've adopted further optimization on the 9th version of prevention control measures and the 20 points. And the second category of the optimization has been emphasizing targeted approaches in light of addressing the most pronounced problems, in particular for the ineffective implementation and inaccurate implementation of the measures, where we've received the most of the general public's complaints. We emphasize being more scientific and targeted in our response. Localities are required to have the package of coordinated implementation of these measures to ensure all these optimization measures can be implemented.
So all in all, the further optimization of the measures is for the purpose of safeguarding the life and the health to the maximum extent and to minimize the impact of the pandemic to the socio-economic development. We will continue to have the prevention control and the research and study, and we will summarize and making adjustments, taking baby steps without stopping, and to continuously optimize the prevention control measures. From Xinhua News Agency, we have noticed that compared with the 20 optimized measures, the new control and prevention measures have been making some further optimizations. I want to know whether this adjustment is an active choice or a passive relenting or loosening of the measures. We would like to give the floor to Mr. Liang Wannian. This type of optimization is not really a complete relenting or loosening up. It is an active choice instead of a passive loosening. Actually, based on the features of the current variant that has been prevalent in our country and also the trending of the pandemic, and based on the dynamic research of the pandemic and also based on the assessment of the prevention control measures, especially after the summarization of the implementation of the 20 measures. So based on our accumulation of the lessons after the implementation of the new 20 measures, based on all the above factors, we have come out with the optimized measures. We believe that they would be able to better cope with the new features of the COVID-19 new situation, as well as based on the mutations of the virus, so that such control would be more scientific and precise and more operational and targeted, so we would be able to more effectively utilize the prevention control resources and coordinate the COVID response with the socio-economic development to guarantee the normal life and the production and the access of the medical needs and to protect the life and the health of the people to the maximum extent and minimize the impact of the pandemic to the socio-economic development, taking baby steps and without stop is really a very valuable experience of China. So currently the pathogenicity and virulence has been attenuated and the vaccination rates of 3 doses across all the population has exceeded 90%. The awareness and the literacy of the mass public in health has been greatly enhancing. We are facing new situation and new tasks. This types of optimization is really a materialization of the principle of putting people first and putting the life and the health of the people as a priority. We believe that it is a measure of continually optimizing the COVID-19 responses, especially by enhancing the vaccination ratio among the seniors and enhancing our preparedness of the drugs and other medical resources and strengthen our capabilities in the prevention control so that it has already provided a very favorable condition for the future optimization of the measures. Well, it has made us more prepared to finally tame the virus at the end of the day. Currently, for the patient, what types of treatment measures have been taken? And also I want to know about the reserve and the guarantee of the medical institutions when treating the infected, and whether the household needs to preserve any drugs, especially for the families with a senior and child. What types of preparation do they need in the storage of the drugs. Thank you for your questions. As you know, that the feature of the Omicron variant is high transmissibility and stealth transmission, as well as milder symptoms. But with the mutation of the virus, the majority of the infected are symptomatic or light cases. For all these years, we have accumulated the experiences in the treatment, and based on the symptoms and the clinical experiences, we have actually summarized the following treatment measures, as well as our experiences in the accumulation or the storage of the drugs. As you know, some of the patient might have the symptoms of fever, cough, or sore throat. We would just treat it accordingly. For example, we would give them the antipyretics or drug, the cough killers, and other types of corresponding treatment. And secondly, for the antiviral treatment, for the normal types of patients or those patients which are prone to be developed into serious cases, so we can give them antiviral treatment. But antiviral treatment should be conducted under the guidance of the doctor. And thirdly, recent years have seen the wonderful examples of the combination of the Chinese and the Western medicines. The Chinese traditional medicine, especially in treating the diseases, have its particular merits and advantages. So currently, we have seen some wonderful Chinese medicines being applied during this process. And fourthly, we pay great attention to the treatment of the COVID-19 with that of the underlying diseases. So the underlying diseases treatment, like diabetes or high blood pressure, cannot be suspended just because of their infection of COVID-19. So while treating COVID-19, the underlying diseases continuous treatment shall not be neglected. And for the drugs, it is indispensable in the treatment of COVID-19. We have required all the medical institutions above the county level to enhance their storage and preparedness of such antiviral drugs, also including the antibody reagent and as such. And through such a characterized and classified treatment mechanism, we know that many patients may choose to rehabilitate at home. So we would ask the basic level medical institution and the clinics to have the preparedness on the drugs to ensure the accessibility to the drugs. And we would also like to educate the public to know how to use the antibody reagent test kit and how to use such types of drugs. And we would also like to remind you there is no necessity for you to hoard or storage the drugs in large quantities, because not only in the pharmacies but also in the medical institutions, we have very sufficient storage and provision of such drugs. From CCTV economic channel, as you know that many patients, if they are having a fever, they can choose to be treated in the clinic, fever clinic. And what is the procedure of the treatment in the fever clinic, and can they have a closed loop management for such a patient, and how can we play a centenary role of the fever clinic? Actually, indeed, a fever clinic is some venues that all of us are quite familiarized with because of the last years of pandemic. Actually, when the patient go to the fever clinic, the doctors will ask about the historical record, including some symptoms and contact history, and some tests will be conducted, including the blood test as well as the pathogen test. If it is necessary, some imagery test would also conducted. So after such a preliminary assessment of the symptoms of the patient, then the treatment measures would be provided accordingly.
The first physician taking care of the patient should be responsible throughout the treatment course. So they should set up the record of where the patient has been transferred. We also require the patients to wear their masks, and we require the health professionals to have the standard procedures of operation. When patients go to hospitals, they are advised to avoid going to some crowded places to prevent the possibility of cross-infection. Fever clinic is an important venue to identify COVID-19 infections. That's why over the years we have put forward an array of requirements for the building of fever clinics. First, second level and above hospitals should open fever clinics whenever possible, and also they should run 24 hours a day and 7 days a week. Besides, the clinic should be equipped with enough rooms and a strong health professional workforce to improve its service efficiency. In particular, during the autumn and the winter, it is the season of influenza. Therefore, there is naturally a big need for the febrile patients to go to the fever clinics. That's why we've been emphasizing the expansion of capacity in fever clinics so that the patients can get good services. Third, health institutions, fever clinics, and the local administrative authorities should give the general public information as to where they should go when they have the fever symptom. There should be hotline and addresses of these fever clinics provided to the general public. And if there is a suspected case or infected cases, we will follow the triage for the later treatment. Thank you. With the paper, many seniors, in particular most senior citizens, have concerns on the safety of vaccination. Many elder citizens suffer from hypertension, diabetes, and other chronic diseases. Are they eligible to be vaccinated, and what are the contraindications? I'd like to invite Mr. Zheng Zhongwei to take the question. Thank you for your question. I can assure all of you that vaccines for COVID-19 in China are very safe. Or in other words, benefits far outweigh the adverse events or risks. CDC of China has conducted adverse event monitoring over the administration of 3.4 billion doses among 1.3 plus population. We found that the ADE report rate of COVID-19 vaccine is lower than that of other regular vaccine in 2020, and the ADE rate among 60 years and older is slightly lower than the younger population. We've also provided the world with over 2.2 billion dosages of our vaccines. Over 30 plus countries have their heads of states and governments receive the Chinese COVID-19 vaccine across the world, according to incomplete statistics. For the 60 and older population, more than 1 billion have received doses from Chinese vaccines, and it has been proven very effective. our party leaders and the national leaders have received our own vaccines, and they get the inoculation, the same domestically manufactured vaccine, exactly the same with that among the general public. You've mentioned that some elder citizens suffer from hypertension, diabetes, and other chronic diseases, and they have certain concern. I can be clear that these chronic diseases are not the absolute contraindications for the COVID-19 vaccination. As long as these chronic diseases are well controlled and the patient is in a stable stage, they are eligible to get vaccinated. Of course, we have the plan for, we have the protocol of vaccination for the elderly, in which there are 4 contraindications. First contraindication is that the elderly had shown severe allergy in previous vaccination history, like the allergic shock or the edema. And second, if the elderly is in the acute onset of any chronic disease or in the acute febrile stage, and only when the acute symptom is gone is the elderly eligible to be vaccinated. And third, if it is an oncology patient who is going through chemotherapy or a hypertension patient who is taking the treatment for the hypertension, and the cardiovascular patient is having myocardial infarction, and some of the patients are in the acute onset stage of any of the severe chronic disease. After their acute onset symptom has been brought under control, they are still eligible to take the vaccine. And fourth, for some severe chronic disease patient who is at the end stage of life, we do not advocate the vaccination. Again, we'd like to emphasize that eligible elderly are advised to take vaccination whenever possible to protect their life and health. Thank you. With China Daily, localities are implementing the optimization measures. How can they be scientific and targeted in their implementation? It's possible that localities may have oversimplification, one-size-fits-all approach, or arbitrary imposition of restrictions. How should we respond? I'd like to invite Mr. Wang Heshen to take the question. Thank you for your question. Constantly optimizing policy is the focus of doing a good job in our prevention control measures. To implement good policies, the key lies in being scientific and targeted. First, we need to ensure the full party accountability system, that is the accountability of locality department, organizations, and individuals. We need to step up the grassroots and community prevention control workforce, improve the triage, treatment, and diagnosis in community health institutions to provide better health management services to the citizens. For metropolitans with a big and dense population, we need to ensure our monitoring and early warning system is more sensitive and be more refined and efficient in our implementation of the measures. Second, we need to ensure coherence and consistency of different policies. For example, when we are phasing out the blanket NAT testing, we must ensure those who have a need for NAT testing can get NAT testing services. And second, we are now allowing putting infections on home-based quarantine, but at the same time, we must avoid community transmission. We should have a good preparation in the supply of medical resources with a focus of channeling prevention control resources to people at risk. We should have a mapping of their health conditions, their information. We need to be more robust scientific, refined, and affectionate in our work. Third, we need to continue to carry out the patriotic health campaign to foster health environment and build healthy homeland. We should provide more information, education to the general public to improve their literacy and understanding of the diseases, so that they have a better knowledge of personal protection and disease prevention. The general public know clearly when they should seek medical services and where should they seek medical advices. We need to listen attentively to their opinions, respond to their concerns, and guide the general public to carry on good habits fostered during the prevention control and carry them on for the longer term.
And fourthly, we should avoid the arbitrary imposition of the restrictions, especially the lockdown areas and the risk zoning should be based on the unit and the floor or the building. Such a kind of blanket testing shall not be conducted, except for some special venues. No NAT test result needs to be provided, and the health code and the mobility code will not be checked anymore. For those personnel who have cross-region travels, no NAT test and no health barcode and no mobility code will be checked. No more arrival test will be conducted, so as to minimize the impact of pandemic to the social and economic development. What needs to be emphasized is that all the department and all the localities would need to set up a task force to fully implement the requirements of the new 10 measures and to know how it is implemented, and the training and guidances should be conducted to the officials and the personnel of all levels so that such personnel would be able to fully understand the requirements of the policies. And during the implementation of the measures, the urgent, much anticipated, difficult issues of the public shall be well resolved. And once there is a complaint, it should be handled as soon as possible so that a better service should be provided to the public to safeguard the interests of the public. As we know that winter is a high occurrence season for the COVID, and added by the occurrence of flu, as you know, we are facing a high pressure of the prevention control, and facing what we are having right now in the COVID, the current optimization seems to be conducted in such a scenario. Are we going to face any risks? Are we fully prepared? And we would like to give the floor to Li Bin. Indeed, the overlapping of the flu as well as other respiratory diseases are overlapping with the COVID. Indeed, the COVID response pressure is on a rise. The purpose of the optimization of the measures, for one of the purpose is to reduce the impact of the pandemic to the normal life and production of the public, so as to better and effectively allocate the resources and to put our resources on the treatment of the severe and the high-risk population, and we can better coordinate the COVID response with that of the normal medical services so as to better satisfy the health needs of the public. And currently we pay great attention to the mutation of the viruses as well as the severe and the fatalities, and we would need to see the how much the medical resources have been used and whether there is overstretching of the medical resources. So we have enhanced measures in the following regards. First of all, it is about the R&D and the vaccination of the vaccination. Currently, the whole population 3 doses vaccination has exceeded 90%. Recently, we have some very important deployment of the promotion of the vaccination among the seniors. We have also enhanced the R&D of the drugs and its production, the storage, especially of those drugs targeted on the seniors and the children, so that we can have a better preparedness in the COVID-19 drugs and the CTN. And secondly, we have enhanced our preparedness of the medical treatment resources. We have a better triage system, and some ICU bed and severe diseases bed in the designated hospitals have been added. And we have trying to coordinate the treatment of the COVID-19 infections with that of the normal operations, so as to satisfy the normal medical services. And we also need to enhance the capabilities in the grassroots level, so that their capabilities of the COVID-19 response and the health management capabilities would be further enhanced, better playing a role of the goalkeeper. And fourthly, we need to enhance our monitoring of the virus mutation, seriousness of the diseases, and the usages of the medical resources. Enhanced prevention control should be conducted in the areas of nursing homes, medical institutions, kindergartens, primary schools and middle schools, so as to maintain the normal operation of the society, and also trying to resolve the urgent, difficult, much anticipated issues. And fourthly, we need to gather the social consensus, and we believe we need to enhance the awareness of the public, and they have a much heightened personal hygiene awareness. We also always need to be prepared to face up to the possible worst. Currently, we are still witnessing the ravaging of the COVID-19. We still have the lingering risk of the pandemic. We need to make all possible efforts and preparedness so as to maximize our protection to the life and health of the people, and minimize the impact of the pandemic to the life and the production of the mass public, so as to better protect the interests of the public. We have noticed, actually, with the decreasing of the severe and the fatality ratio of the Omicron variant, many countries have adjusted their COVID response measures. For example, the cancellation of international travel bans and on the congregation of the public. And there are some kind of arguments saying that our adjustments is slower than most of the other nations. Is that so? And what kind of consideration do we have to have such a pace of the adjustments of the COVID-19 response? Thank you for your question. The adjustments of the COVID-19 responses is a systematic work. It involves every aspect. Actually, one adjustment would have a radiating effect to all the COVID response that we have in general. So that is why we need to consider all kinds of measures. For example, the features of the virus, the epidemiological features of the diseases, as well as the trending of the pandemic and the immunity of the mass public, as well as the capabilities of treatment of the medical system, and also the pandemic situation domestically and internationally. The prevention and control measures would also be influenced by the doctrines of such prevention control and also its priority objectives. I believe internationally the reasons for some countries of letting off or relenting its measures is because that certain amount of the population in the first several waves of the infection have gained a natural induced immunity. As we know that some countries have paid a heavy price of of the fatalities of its population. And secondly, the coverage of the vaccination ratios, especially among the senior, have reached a comparatively higher level. So based on such attenuated pathogenicity of the new variant and added by the enhanced capability of the medical treatment measures, it is really a comprehensive consideration. But the majority of the countries are not really having a complete loosening, but they have shifted their focus in the prevention control. For example, their focus would be put on the prevention on the overstretching and the overrun of the medical resources, and their adjustments of the strategy and the measures are prioritized. It is not really a one-set approach. And our country has been keeping a close eye on the changes of the virus and the diseases. We have been trying to have the prevention control while making adjustments and enhancing our capabilities so that we would have study of the conditions and the protocols so that we can optimize our protocols based on the dynamics and trying to find the optimized COVID controls. With the continuous optimization of the treatment protocol and the control protocol, it has fully reflected such a logic and a concept.
Be well prepared, and improvement of the response capacity needs time and cannot be achieved overnight. China has a big population and a big population of the senior citizens, and also a big swath of people with chronic diseases and underlying diseases. And compared with European American developed countries, the health resources for per 1,000 people in terms of the physician numbers, bed numbers, and ICU numbers, we are trailing. In particular, the distribution of health resources are uneven. The vaccination coverage, in particular, the coverage among the elder citizens and people at risk, are far from ideal and perfect. The preparation in medicines and the stockpiling of prevention control supplies need to be beefed up. That is our national conditions. That's why since the outbreak of the pandemic, apart from the regular and ongoing prevention control efforts, we've been active in accelerating the research and development of pharmaceuticals, vaccination, capacity training, the stockpiling of supplies. Remarkable achievements have been scored. We've substantially improved the capacity in the response and the resilience of our health sector, creating conditions for us to optimize and adjust our strategies and measures. And these are also the cornerstones to the final victory against the pandemic. Thank you. With the cover, we've noticed that the spacing between the basal immunization to the booster has adjusted from 6 months to 3 months. What are the considerations behind such an adjustment? Are there any influence on the immunization efficacy? Mr. Zheng Zhongwei is taking the question. You've noticed that in the current protocol, the spacing before the booster dose had adjusted from 6 months to 3 months. It is based on the sufficient evaluation of the data generated by the researching institute, and it has been thoroughly discussed by experts. Such adjustment is scientific and is in alignment with the specific needs of China's prevention control. I'd like to talk about 4 points. First, across the world, the spacing before the first booster dose has been adjusted from the original 6 months to fewer months. It is based on the pandemic evolution and also the vaccine supplies. Most of the countries and regions has adjusted the spacing from 6 months to 3 months. data has shown that either 3 months or 6 months have been proven effective. Our Research and Development Institute have conducted clinical trials and real-world study data collection. We've noticed that if the spacing is 6 months, the neutralizing antibody is not as high as that has been generated for if the spacing is 3 months. 3 months as the spacing before the booster dose can see the same level of neutralizing antibody when it is compared with the 6 months as the spacing. That has shown that the 3-month spacing is scientific. And third, being it 6 months or 3 months, it is equally safe. Fourth, the spacing adjustment has also come as the need of our national realities. We are faced with grim challenges, and a very important task for us is to promote the vaccination of the elderly, especially the most senior citizens. The adjustment of the spacing before the first booster dose will help us to further meet the needs of the reality in our prevention control efforts. Thank you. With Shenzhen Satellite TV, we've noticed that in the new points of prevention control measures, the blanket testing is removed, no longer following the administrative jurisdiction. However, NAT testing is still needed for nursing homes, health institutions, and the orphanage. So what about those patients who have emergent medical needs but without an NAT testing result? Madam Guo Yanhong is taking the question. Thank you for your question. First, we'd like to emphasize that for any patient with emergent medical needs, the NAT testing result is never justification for refusal their access to medical services. Saving the needed and helping the needed are the noble task of any health institution. No health institution should use NAT testing result as the excuse for refusing any patient. Many patients may be the critical case patients who emergently need medical services. It is imperative for any health institution or health professional to provide them with the services. We require all health institutions to implement the first physician taking care of the entire treatment process of any patient. The rescuing and treatment of a patient should never use NAT testing result as the prerequisite. Second, for patients going to emergency services, if they do not have a NAT testing result, we require health institutions to set up a relatively independent buffer zone. Health professionals can have better protection for patients in emergency need of health services, but without NAT testing results, they can be put in the buffer zone area for their NAT and antigen tests to be taken in this buffer zone while ensuring their emergency treatment. We also require all health institutions, being it in the rescue rooms, the theaters, the emergency rooms, the dialysis rooms, all the wards. Buffer zones should be set up in all these functional rooms to be separated from other diagnosis and treatment zones. If we identify positive case, patients as such can be effectively sent to the buffer zone for their continual treatment. By so doing, we can ensure the medical treatment of the patients while minimizing the potential risk of hospital-acquired infection to protect the safety of the majority of patients and health professionals in the hospitals. Over the years, We've been prioritizing people's life and health. We have been people-oriented. We've adopted an array of measures to ensure the medical needs of the COVID-19 patients and the medical needs of all the general public can be met as equals. We've been efficiently coordinating the treatment of COVID-19 patients and the regular medical services. With the Red Star News, what are the conditions that may facilitate us to recover and go back to the life before the pandemic? Are we ready for that?
Thank you for your question. We should say that with our deepening of understanding of the virus and the disease, the hazardness of the disease had been reducing, and with the sufficient and effective provision of the virus and the drugs, and with the enhancing our capabilities of the emergent needs are all the very important factors for our resumption back to the normal life. Firstly, it is about the features of the virus. Currently, even though the COVID-19 virus the pathogenity is obviously attenuated, even though it is with a high transmissibility. We have a higher proportion of the asymptomatic and light cases, and we have compared with the original variant and the Delta variant, its severe diseases and fatality ratio is on a plummeting trend. And that is to say the virus is becoming milder. Secondly, the popularity of the virus. Currently, our country has a comparatively higher vaccination coverage. However, the vaccination among the senior is not ideal. All kinds of research has shown that no matter what kind of vaccination, it can effectively reduce severe diseases and reduce fatality. So, to have vaccination, it is a much better protection, and especially the boosters would provide better protection in the prevention of the severe diseases and fatality. And thirdly, about the effective treatment of pharmaceuticals, we are already equipped with all kinds of drugs, including CTM and also domestically produced micromolecular oral administered drugs and other antibody drugs. And fourthly, we have formed such an emergency system and coordination mechanism which has been proved to be highly effective. And fifthly, we have a group of personnel and emergent response staff, especially in the grassroots level. The grassroots level professional prevention control and management system, after more than 3 years of the test, have been optimized and their capabilities have been greatly enhanced. And fifthly, we have seen the enhancement of the prevention, control, and treatment capabilities in the medical systems. For example, we have constructed some designated hospitals and the cabin hospitals. We have also enhanced our preparedness in the training of the medical staff as well as the preparedness of the medical supplies. And seventhly, we have seen the heightened health literacy among the public. The figures has shown in 2021 that the health literacy level reaches 25.4%, which marks a 2.25% compared with 2020, and this trend is on a continuous rise. All these has been providing buttresses for us to further tame the virus. Currently, what we really need to pay great attention is the mutation of the virus as well as the severe diseases and the fatality. We need to strictly prohibit the scenarios like the medical resources being overstretched. For these aspects, we have made some sufficient preparations, and we are also trying to enhance the measures that we have introduced, as introduced by Mr. Li Bin just now. Hereby, I would also like to stress that we still need to do a better job in the preparedness. Firstly, it is the vaccination rolling out, especially among the seniors. And secondly, we need to enhance our R&D production storage of the drugs so as to satisfy the needs of the patients. And thirdly, we need to strengthen our monitoring of the virus mutation, especially of the transmissibility and pathogenicity of the virus. And fourthly, we need to optimize the medical and treatment protocols and the resource preparedness. For example, the classified and characterized treatment protocol, as well as its implementation, the treatment facilities and equipment, materials, space, and the personnel's preparedness, and etc. And fifthly, it is the strengthening of the capabilities in the grassroots level so as to enhance the capabilities of the grassroots level as well as the health management capabilities. And sixthly, we also need to strengthen the protection of the designated venues and the populations. For example, the hospitals, nursing homes, charity houses, primary schools, kindergartens, and especially as such, and also of the.
第二位男记者，请左侧区第4排第2位男记者。
谢谢中新社记者提问。加强老年人新冠病毒疫苗接种工作方案提到了6种接种的组合，想请问他们对于预防新冠病毒的效果是否有差异？有没有优先推荐的接种组合？谢谢。
好，请郑中伟先生来回答这个问题。
好，非常感谢这位记者朋友的这个问题啊。这个大家都知道啊，在疫情发生后，我国快速推进新冠病毒疫苗研发工作。我们布局了5条技术路线，那么得益于我们国家的制度优势和我们在推进疫苗研发过程当中的一系列的机制创新，目前我国新冠病毒疫苗技术路线多，获批种类多，加强接种组合丰富。那么在这次方案当中的话，我们推出的6种组合都是在专家充分论证基础上，按照有关的法律法规程序批准推出的。那么这6种组合都是安全有效的，只要我们接种了加强针，那么对重症、死亡的保护效果都非常显著，预期对感染也有一定的保护效果。那么具体到在这个接种的实际当中，您刚才提到，有没有推荐选择什么样的组合？我刚才说了，这6种组合都是可以推荐，都向大家推荐。但是具体到接种的实际过程当中，可能我们在不同的接种地方，在不同的接种点，那么由于疫苗的供应或者采购的原因，那么可能有部分疫苗不一定都可及。但是大家一定不要因为只要你在这6种组合当中选择任意一组组合进行接种，那么你的生命健康和身体安全都能得到非常好的。在这个地方呢，我再补充一点，可能大家也非常关注，就除了老年人以外，我们很大一部分人群，就是18到59岁的人群，接种时间也有很多超过6个月了，那么是不是也需要接种加强针？那么在这个地方也可以明确告诉大家，需要接种加强针。那么接种的间隔时间也可以调整到3个月。
好，谢谢，请继续提问。好，我们先来请右侧区第3排最靠里边这位女记者。
谢谢发言人。法新社提问，我有2个问题。 第一个问题是，中国政府什么时候会开放入境防控措施，取消或者调整核酸检测和入境
border controls and also trying to adjust the AT and the quarantine requirements upon entry into China? And second question is whether NHA would also give a clear guidance on the vaccination and such a vaccination certificate, whether it would be provided. Why we haven't really rolled out such measures of providing the vaccination certifications when accessing to the public venues?
Thank you for your question. These are questions of common concern. This round of optimization measures are targeted at domestic prevention control for inbound traveler management and preventing imported cases. We will have a law-based and scientific optimization of the measures and accelerate the study on the current measures. And I'd like to invite Mr. Zheng Zhongwei to take your question related to vaccines. We've noticed that some countries have put forward directives on vaccine certificate. Countries may see it effective in improving the vaccination rate. But as Minister Li Bin has mentioned, the entire population's vaccination coverage, even the 3-dose vaccination rate, is pretty high. And for the age group between 18 and 59 years old, the coverage is already 95%. This is a pretty high coverage rate and on the entire international stage. Why are we adopting a particular protocol on the vaccination for the elderly? It is because the vaccination of the elderly is relatively lower compared with other age groups. But with the recent measures, we've seen there has been rapid improvement of the vaccination among the elderly. As you've mentioned, all these must be based on the law-based governance, and it is not a compulsory or mandatory directive. So we have our laws and regulations to follow. Thank you. In the interest of time, we'd like to take the last question. With the Dragon TV, the optimization measures have emphasized that the mapping of the healthy population and the classified and categorized management. What are the specific content of this management? I'd like to invite Madam Guo Yanhong to take the question. Thank you for your question. It is very much a question under limelight of the management of the positive cases. Highly efficient coordination of health resources and making our best efforts to ensure treatment of COVID-19 patients and ensuring infections of high risk can be timely treated. That's why we've adopted the principle of health monitoring, categorized management, cascaded coordination, and effective treatment. That's the reason of us adopting the categorized and classified diagnosis and treatment to ensure the coherence and the efficacy of medical services. We are also stepping up and beefing up the health resources stockpiling to support and underpin the scientific and orderly medical services to better protect the health safety of the general public. First, for the asymptomatic and mild cases, they can have the home-based quarantine to take care of themselves. As long as their situation is relatively stable. For the senior citizens with mobility challenges, we also suggested them to have home-based treatment. Health professionals can provide them telemedicine treatment and services, and health professionals, in particular the grassroots level or community health professionals, can deliver services to their homes, and senior citizens with mobility challenges don't have to be transferred to hospitals for treatment. Second, for the cases with severe cases or the risk of developing into severe cases still have to go to the designated hospitals to get treatment. We've selected the comprehensive, most capable hospitals to be the designated hospital for COVID-19 treatment. We've been improving the capacity of these general hospitals in COVID-19 treatment. Third, there are also patients with underlying diseases, and they go to the general hospital for treatment of their diseases or chronic diseases, but during their treatment, they may find that they are infected with COVID-19. But these patients have severe symptoms of underlying diseases. We ask all health institutions to be prepared for such situation, because for these patients, since their underlying diseases are the most challenging difficulty for them, therefore the general hospitals must optimize diagnosis and treatment protocol, set up buffer zones to ensure patients with underlying diseases but detected with COVID-19 can be receiving optimal treatment. To ensure the orderly development and provision of health services, we ask localities to focus on the provision of services by general practitioners, to have a mapping of people at high risk, improve the system of first physician taking care of a patient, responsible for the entire treatment of the patient, ensure the medical needs of the general public is met. We will further improve the building and preparation of health resources. In particular, we will further beef up the capacity of fever clinics and general hospitals by providing them with more beds, equip them with the medicines, equipment, and health professionals. We will gradually and constantly improve treatment capacity and efficacy. We will refine management procedures, service procedures, improve the healthcare quality, so that we will have the stable provision of health services to better safeguard the general public's health. Thank you. On today's press conference, our guest speakers have introduced measures for further optimize our prevention control. We've noticed that after adoption of the optimization measures, there has been wide public attention. Tomorrow we will hold another press conference, and please stay tuned. With that, we conclude today's press conference. Thank you.